Hi, good evening. Warm welcome to you. I'm Dr. Kish and thanks for joining me live on What Med Media for what is a slightly special surgery because I'm going to be talking about something the new scientist. We're going to be playing Boris's clip about we're on a downward slope, so it's great to see him back, obviously, recovering and now giving the press conferences. You might think that 8 o'clock on a Thursday is a bit of a weird time to do this because it conflicts with the clapping, and I hope after everybody claps they end up joining. But the reason that I've chosen this time is actually quite important. And whilst I can't share the name of this person because it was a private post just within friends, I think it captures an important mood, right? And it says, to be honest, I don't really feel like clapping tonight. It's starting to feel a token and like a distraction, sad emoji. I did a locum session at homeless practice this afternoon. Very vulnerable population, not good at distancing. I expect I had to see a possible COVID-19 patient. There was one gown for the whole practice. The nurse had been seeing high-risk patients all week with bare arms, just gloves, apron and a mask, and was the one getting nearer to the patients. I consequently did not feel justified in using the last gown, although I certainly would have preferred to have worn this as per WHO guidelines. And there's also something in this about the World Health Organization. We're also going to talk about how I'm going to share with you the clip that we've done on Sky, or was just done on Sky, and we've also posted it in terms of how the World Health Organization are not going to be invited to cooperate with China's investigation into this, which I find incredibly concerning and also something that we need to call out as pseudoscience, because for the labs where this was investigated, the first 2 labs in Wuhan, for those records not to be disclosed to the World Health Organization, an independent body, an independent arbiter who's interested in global health, is just an absolute travesty. I would have preferred to have seen him without. I could have. This going back to this person that was talking about somebody who didn't want to clap. I could have managed him without seeing him at all, but I wanted to talk to him in person, ask a few questions and generally see for myself to make the best clinical decision. My colleagues at hospital are at more risk and deserve priority, but I still feel angry that I was in his position. As a locum GP, I might have to consider buying some gowns myself rather than rely on what will be provided for me. On that point, GPs wouldn't be alone in buying gowns and PPE for themselves. I know a lot of people in M&S, for instance, are having to resort to buying their own gloves. I found out about this and I dropped some gloves off. We had a little bit of a chat about how they needed to go through a procurement process in M&S Watford, but then I was basically trying to explain to them in my mask, fully gowned up in the supermarket, saying something along the lines of, what did I say? Oh yeah, I'm not trying to sell them to you. I just want to give them to you. But no, that wouldn't happen. So in the end, I just gave them to the staff in M&S. And then I went back today and they gave me this little card, which is really sweet. And they said, "Dear Kishan, thanks so much for your kindness. Kind regards, Pauline, Rita, David and Jane, and all the food team who are very grateful. Thank you." These weren't my gloves, to be fair. These were Sanya's gloves that Sanya sent on to me to use and also distribute to those that are most needy. And I think, you know, M&S in Watford, you can't hide behind the fact that there's a national shortage of these masks, or gloves even, sorry, and that they need to be used in the NHS, because as the massive company that you are, I would really expect you being able to invest in protecting your staff and the front line, because ultimately that is what a responsible business does. Because not only are you protecting your staff, but taking that approach, you're respecting the public health as well, because everything that those people touch then goes into somebody's bag. And although the evidence is weak and limited in terms of wiping stuff down, as we talk about a bit in this, I don't know whether it's this week's, but the latest New Scientist, I think it's this week's, M&S really need to take that seriously. So I hope next time I go in M&S, they have gloves magically. If they don't, we will keep supplying them. And next time I'll do a video outside M&S in Watford, in my mask, in my gloves, just walking by, because it is an absolute disgrace. Okay, so that's the first thing. The other annoying thing that they've done in M&S, I mean, this is a real first world problem, right? The fact that I'm complaining and sort of moaning about what it's like in M&S. I'm very well aware that there are people out there that either can't afford to shop in M&S or are struggling to get food full stop, right? And this is not, shouldn't be, all my kind of venom should not be directed at M&S, because I'm sure this is happening in other shops as well, but I'm just sharing an example of what I've kind of seen in the last couple of days. What they've decided to do is they've decided to shut all the fridges, and they've decided to condense the shop footprint into a smaller area. Now, unfortunately, as a result, what that means is actually everybody that goes in there is at far more risk, because social distancing is even harder. So there's a couple of pleas to all shops out there. Look after your staff and set up your shop so that appropriate social distancing can be implemented. 41 people watching. Please share. Please like. It will share it to, send it to other people. It'll be really helpful. So that was very sweet from M&S. We got that. I think what we'll do now is we'll listen briefly to what Boris has just said on the press conference. On the point of news, I've stopped watching the presses because I don't need to. I buy the papers, I dip in and out of social media, and I'm trying to digest and round up some of the news for you guys, because I think this 24-hour diet of news is really, really unhealthy and dangerous, right? So let's have a little listen to what Boris says, and poor network connection. Have a little listen to what Boris says, and I'd be really keen to hear your thoughts in the comments as he's talking in terms of what you think.
I can confirm today that for the first time, we are past the peak of this disease. We're past the peak and we're on the downward slope. I will be setting out a comprehensive plan next week to explain how we can get our economy moving, one, how we can get our children back to school, back into childcare, second, and third, how we can travel to work and how we can make life in the workplace safer. And in short, how we can continue to suppress the disease and at the same time restart the economy.
So that's quite interesting, isn't it? What do you guys think of that? He was breathless, Edith. I picked up on that as well. I agree. He's not delivering it in quite the same way. So, you know, to all those people that were kind of not wishing him well, and also kind of being conspiracy theorists about as to whether he was actually ill, I agree, Edith. I don't know if you're a doctor or a nurse or whatever, but I agree. I did think that he was very breathless when I was watching that. So I'm glad someone else has picked up on it. Yeah, sorry, poor connection. I think it's just internet all over the country, to be honest. But yeah, any other little questions, any other little comments on that? What do you think? My take on this, for what it's worth, I guess that's why you guys tune in, is, yeah, we might be coming to past the peak of the initial peak or the initial spike, but it's very interesting to remember and think that there is first wave, second wave, third wave potentially. So whatever this plan is, whatever these measures are that are outlined, they need to be aimed at ensuring that the second peak is not more devastating than the first peak. I would suggest that's the first thing. So that was that. Then the second thing is, if you scroll back on the What Made Media page, and I'm just having a look to just line up the next video, we have posted it on YouTube and it is on the page, but I wanted to spend some time with it now because it's obviously Dermot, who I can now say my friend Dermot, having appeared with him and being interviewed by him. I found this quite concerning, right? And this is the only bit of news. Hello, Gemma. This is the only bit of news that I've watched today, right? It's only 3 minutes and 39 seconds, but I'd like you to watch it because it's going to appraise you of the facts in terms of the World Health Organization and China not wanting to cooperate and share data in the labs. It's complete pseudoscience because the scientific method is around sharing your working, collaborating, being open and sharing with people. So the 42 people that are watching, if you wouldn't mind hitting share, if you wouldn't mind hitting like, I would really appreciate it, because it just makes it a little bit more worthwhile, because it gets to a few more people. So this was broadcast less than an hour ago on Sky News with a special report introduced by Dermot Murnaghan.
Now, one of the World Health Organization's most senior officials has told Sky News that they've not been invited to participate in China's investigation into the origins of the coronavirus pandemic. Dr. Gauden Galia, who is director of the WHO's Division of Non-Communicable Diseases, said that there was no good reason for them to be excluded. Well, Tom Cheshire reports now from Beijing on the growing criticism of China.
China has insisted that investigating the origins of COVID-19 should be left to the scientists. But those scientists do not include the World Health Organization, according to its representative here.
Is the WHO doing work right now into the origins of the virus?
We know that some national investigation is happening, but at this stage we have not been invited to join. We are expecting to get in the near future a briefing on where that is and to discuss possible collaboration.
So you still haven't been invited by the Chinese authorities to take part?
Up to now, we have not had the invitation, no.
I mean, that must be frustrating.
One tries not to get emotional, one tries to simply follow the process.
Is there a good reason not to include the WHO at this stage?
From our point of view, no.
And any investigation should include the 2 labs that handled viruses in Wuhan. The WHO has visited one, but not received any of its logs.
From all available evidence, WHO colleagues that in our 3-level system are convinced that the origins are in Wuhan and that it is a naturally occurring, not a manufactured virus.
Doubts have also been raised about the reliability of China's numbers. In early January, the official number of coronavirus cases stayed unchanged for nearly 2 weeks before sharply rising.
We only know what China is reporting to us. Is it likely that there were only 41 cases for that period of time? I would think not. Is that a matter of difficulty in finding where they getting their act together? Is it a question of definition? I cannot speculate, but it would have been that during that period, obviously, some growth would have been happening.
And yet for 2 weeks it simply stays the same. I mean, that seems to beg a belief.
It is unlikely that that with an epidemic of this nature, that it stays at 4-1 exactly.
And the key question for the whole of January was whether the virus could be transmitted human to human. As soon as the WHO arrived in Wuhan on January the 20th, they had their answer.
The healthcare worker was simply volunteered the moment we entered the fever clinic. We were shown around this, at that point, makeshift system that had been set up. And we simply asked it as one of the first questions, and we got it immediately. We got that answer. In that case, they said they had 2 healthcare workers that were infected.
Answers like that, however long in coming, were crucial for transparency. Right now, China isn't giving them, at least not to the WHO. Tom Cheshire, Sky News, Beijing.
So that's really interesting, isn't it? And I saw lots of comments on that in terms of like people saying, I don't trust their numbers, not really sure, this sort of stuff, right? And I found out yesterday, if you Google it and tell me what it says, if you Google China's missing phone numbers, COVID-19 crisis, right? Before you Google it, have a guess in terms of between January, February and March 2020, how many numbers were disconnected in China? Now, the important thing that you need to remember for this is in China, a mobile phone is even more integral to daily life than it is here, right? It's your social security, it's the way you access healthcare, you get taxed, you get charged through the WeChat app. It's just absolutely impossible to live without a phone, right? So that is important before we talk about the numbers, because the first thing is just to set up that it, you can't say it's, oh, I don't know, people just decided not to have phones, or they got rid of them, or they're about to upgrade to 5G, so they just dumped them, right? That is highly unlikely, in my opinion. So we've established how essential phones are in China, right? So yeah, it was many thousands, Emma. It was 21 million. It was 870,000 landlines and 21 million cellular connections. Now, the reason that is actually really important. And, you know, you're saying that you don't trust the numbers, and that's fine. You don't trust the numbers. That's your opinion. But one of the big goals of this was in terms of WhatMed, and certainly in this crisis, was how do we engage the public to make sure that they are critical of what they see. And don't just take my word for it, right? Just research it. Think about it. Challenge me. If I say something that I think and I get it wrong, I'd be really keen to hear from you and let me know. So no, Lisa, way more than 10k. So the number of numbers, it was 870 landlines, which is okay. That's less ingrained in way of life. Thank you, Mike. That's very kind. I guess that's the story. But there was actually 21 million cellular connections have just disappeared and been deleted. And this information came out through Bloomberg, so it's a credible news agency. Now, if you look at what Chinese population is, which I believe it's around 1.7 billion, and then you crunch the numbers, that comes out to between 1.3 and 1.4%. Now, remember, right back in the early days, people were saying that the global mortality of this was expected to be around the 1% mark. So that's my thinking. That's an example of me following the science, being a scientist, sharing it with the public, collaborating, and saying, what do you think? You're adults, you're grown-ups, we can have a discussion about it. There's no point in hiding data around it. Because ultimately you cannot suppress information in this world, right? It's just not possible. So that's that. I thought that was quite interesting. I saw that and I was very concerned, the fact that the World Health Organization are not allowed in, and I think we should read into that quite a lot. But so that's that thing. And then the final thing that I want to talk about is I saw this, and it was by Graham Lawton, who's a staff writer at The New Scientist and author of This Book Could Save Your Life. I haven't seen that book. I don't know if you've read it and see what you guys think of it. But in his column, he says, no planet B. And he's talking about hyperconsumption is one of the things that got us into this mess. And we have to avoid the temptation to rely on it to get us out again. And the strapline is time to get thrifty. So he sets up at the beginning in terms of saying that Amazon is apparently making sales of $11,000 every second of the lockdown. And his initial reaction was weary resignation, he says. Then he goes on about, he sets up the argument about how this kind of quest for perpetual growth year on year is destroying both the planet and also people, okay? And then it kind of turns out, and he goes, thankfully, it turns out my initial reaction was wrong. And that's another part of the science, right? Is in terms of, you have a hypothesis, you test it, you collaborate, you show people, you peer review it, and then if you are wrong, you be open about the fact that you're wrong, and you say, actually, no, we're going to change tack. And we're going to change tack because of X, Y, and Z. Anyway, oops, just dropped my phone. So thankfully he was wrong. Then it goes on a little bit. The little money being spent is going on essentials, such as food, household goods. Out of necessity, this is shifting online. Amazon's bounce is not a frenzy, but a hunkering down. In that I find hope rather than dismay. I completely agree, Tony. I completely agree. There has been much discussion of the environmental benefits of furloughing the world economy. Oil consumption has gone through the floor, and there is increasing talk of a green economic recovery. I'm sceptical. Once we get the all clear, I think this is Graham saying this. Graham's saying that he thinks most likely the response will be a rapid push to return to business. And that's also a concern for me as well. Because I think we need to be smart. We need to be clever. We need to think about what are the good things that have happened as a result of this. Healing the planet, having better work-life balance, being more productive. This kind of push towards home working that would never have been embraced at the scale that it was. That is touching multiple sectors. It's touching healthcare. It's touching every single business apart from the key workers that have to be on the front line, right? But anyway, so he talks about that. He thinks once we get the all clear, there'll be a big push on here we go. So I think, says Graham thinks the most likely response will be a rapid push to return to business as usual, encouraged by leaders whose electoral prospects hinge on an economic recovery. But I also have hope, because the pandemic and its aftermath might permanently shift attitudes away from hyper consumption. Consider the enforced changing in his family's habits. In the area known as BC, which is before coronavirus, our food shopping worked like this. We decided what we wanted to eat, bought it and ate it. I knew that I should have been buying local and seasonal, but habit, convenience and deliciousness won out. This has now been upended. I now avoid the supermarket. I do too, to be fair, right? I now avoid the supermarket. I haven't been to Tesco's in 6 weeks, right? I only go... The reason that I go to M&S, to be fair, is because in the early days, they actually did spread people out and there were less people in there. Now they're letting more people in, or maybe they're not. It's just they're more concentrated. I might have to reassess that. This has now been upended. I now avoid the supermarket. The shelves are well stocked. We owe our thanks to staff who kept them that way. But the hassle of queuing, wearing a mask, of social distancing in the aisles and lugging stuff home and then wiping it down. Then in brackets he puts... I know the evidence for the necessity and effectiveness of wiping this stuff down is weak, but better safe than sorry. Graham Lawton, I completely agree. Better safe than sorry. What harm can it do to wipe some stuff down with Dettol or warm water or whatever before it comes into your house? My honest answer is I would suggest no harm. Obviously, you've got to be sensible with it. Don't douse it to within an inch of its life. But I think, yeah, why not? Lots of comments coming through. Menu planning is key. Yes, I completely agree. I'm not going to read more of this, really, because I think you get the idea. But actually, this is a good bit. Capitalist society has trapped a number of us on hedonic treadmills. And what is a hedonic treadmill, I might hear you ask, because I have no idea. But it goes, you can understand why we have created a hyper-abundant society. We naturally assume that more of anything will make us happier. This is true up to a point, but the psychology of happiness is very clear. Humans quickly become satiated, S-A-T-I-A-T-E-D, that's a dyslexia coming out, by abundance and have to consume ever more just to stand still. Think of all those entertainment services that are so welcome right now. Netflix, Spotify and so on are so great. But when you watch or listen to anything, anytime, you end up taking them for granted. And that is so true. But anyway, so I just thought that might be interesting to share. I haven't got very many questions from you guys, which I think is a bit unfortunate. So Michelle, I think we'll see more of working from home. Companies will become wary of sickness benefits for the next year or so. I think you're probably right. Let's pick my watch up, see what time we're at. So we won't be going 23 minutes, which is also a good time to stop. So I'm just going to say, how are you guys doing? I'm not going to say anything. I'm going to take a drink. I'd love to hear from you. Where are you in the UK? It's only going to be 30 or so people left, so it's not going to be many. If you could just comment where you are, how you are. If you have any questions about social distancing or anything else, no such thing as a silly question. Over to you. And if I don't get any questions, I will call it a night. I don't think we're going to get any. That's fine. So, Lincolnshire. Hey, Alison. Did we ever cross paths when I was in Lincolnshire? Maybe we did. I'm not sure. Hi from Colchester. Hey, Tracy. Edinburgh. Nice. Edinburgh. I got a colleague up there, actually, who the day before lockdown ended up just staying up in Edinburgh. She's got family there, so it's all right. On the hyperconsumption, right? Just because I don't think there's going to be any questions coming through. Hold on. Everything, this is more a comment, I think. Everything people thought was important is now almost irrelevant. And the small things and jobs that count. Completely agree. Lancashire, Yorkshire, brilliant. Maryland, Essex, work in London, nice. So Yorkshire, actually, I'm doing an MD up in Hull York Medical School, actually. What do you think about schools phasing? Okay, that's a really interesting point. And did you see the biggest COVID study yesterday? No, Tracy, I didn't. Please, can you put it in... the comments? Hey, Bristol, Mike Brown. Did you hear me on BBC Radio Bristol ever with Dr. Phil Hammond? If you scroll back on YouTube, you'll probably find it. Norwich, Northwest, brilliant. Nottingham. What was I going to say? Oh, congratulations, Tony. I think I know who that is now. Congratulations on your new baby. I think you just had a baby, haven't you? The mask question, is it worth it outside of health treatment premises? Alan, Yes, I think it is in certain settings, right? So as you'll have seen one of my early videos, cycling them is not a good idea because by the end of it, ringing it out was just completely just awful. But when I go into any shop, I will wear gloves, mask, completely cover myself head to toe, tie up my hair in a bandana, and also sunglasses and mask, so you don't actually recognise me at all. Tracy sent it to you via Messenger yesterday. Thanks. I don't check it though really, so just post it in this if it's the link to something. That would be really helpful because then other people can see it. I saw a question about phasing of schools, right? And that's actually a really complicated question. And I'm willing to share my thoughts on it so you guys are appraised of the facts. Firstly, we know that, well, up until recently, not you, sorry, different Tony, oops, awkward. So I wonder who I'm thinking of. But anyway, we know, or we knew, or we thought we knew up until this point that children weren't affected by it at all, right? However, you would have seen the news breaking 2 or 3 days ago. The sad fact of the matter is that kids are actually having quite a severe vasculitic reaction to it, which is basically where blood vessels in their arms are going very, very red and inflamed. And that's basically, it's a form of Kawasaki disease. That's what it's known as. And they can become really, really unwell. So the phasing of schools and the returning of schools, to me, I think it is a convenience thing and it's an economy thing, right? To get the economy going, you need to get kids in schools, so childcare isn't a problem, so then that can happen. I think we really need to see more innovative solutions in terms of homeschooling, online classrooms, businesses being reasonable and putting on classes for their staff, all that sort of stuff, right? I think that, to me, is the safer long-term solution, but I'm not aware of all the information, all the facts. I think the other thing that we need to be aware of also is that kids will be spreading it, potentially. They might not get it to a severe degree, but they will be spreading it. So therefore, then the question becomes, to what extent are the tracing and contact tracing and quarantine capabilities of Public Health England, to what extent are they sufficient to contain any future outbreaks? I don't know. I think we've had this rife in the population for quite a long period of time. So my suggestion would be that those things, that's my thoughts on schools. But like I said, I'm not in education. It's not really my field, so I don't know. Thanks, Mike. I'm terrified of my youngest getting it. He's bad asthmatic. Oxygen levels always go low. Trying not to think about it, Michelle. So, okay, so I think you're right to be slightly concerned. And also I would suggest that the advice is pretty much the same for everybody, right? Try your best not to get it. We need to counter the disinformation that it's just the flu, doesn't matter, doesn't affect young people anyway. All these idiots going out in the sun, just sitting in the park, right? Under the pretext of exercise. So there's a massive, massive medical education campaign for the public that needs to be done. And I'm, in Germany, again, Gemma, interestingly, Germany, the kids have to wear masks in schools. So, how do we push? I think we educate people. I think we let people know what's going on in other countries. So, what was I going to say? Can't remember. I lost my train of thought, so I'm getting a bit tired. So I'm going to call it a day in a minute. There was another question. Don't know. Oximeters at the ready. Very good, Michelle. Yeah, oximeters at the ready. Try your best not to catch it. If you do, seek medical help early. Push for, wanting to go to oxygen and things, and getting admitted as we talked about in the pulse oximeter surgery yesterday. Sandra, how long do you think we're off a vaccine? It's anybody's guess, really. I mean, the timescales that I've heard have varied between 12 and 18 months, but then I've seen also something somewhere in the press today, somebody, I don't know who, saying, we could get 30 million doses by September, right? So it's the question for me is not when is there a vaccine, because that will come in time. The question for me is, are we going to go down a route of mandatory vaccination for the whole population? What is the evidence behind that? What is the data? What have the tests been on well, a lot of the preclinical studies I think have been fast tracked, but certainly what are the phase 3 results, which are the first time. No, it's the phase 3 isn't the first time in human. Phase 2 I think is first time in human. But when you give the drug to humans or patients for the first time, or you give the vaccine, what is the data? What is the science? What is the modelling? What were the studies that were done? Because that is something that is absolutely essential that the public see, that the public know, and then we can have an informed discussion about it, right? I haven't seen much by way of that, generally, from all governments across the world, from the media that I've consumed from these other countries, to be fair. Obviously, I'm not in those countries, I don't know. But even like this thing with like China, right, not wanting to collaborate with the World Health Organization is another public health disaster waiting to happen. So yeah, thank you very much for watching. Lisa, I think I had it at the beginning of April, very breathless, extremely tired, lasted around 2 weeks. I've joined a COVID-19 forum, and it seems this thing lasts a long time. A lot of people are saying they got better and it came back. Yeah, I've heard that as well, actually. Apparently Germany have seen this too. Do you know more about reinfection? So Germany, I heard today, apparently they've eased the lockdown. But then they have they've eased the lockdown, but then when they eased the lockdown, they saw another spike, right? So one thing from the media and from other things I've heard in like my kind of various spheres and circles and kind of roles that I'm in, right? I've heard that there's a BC era before COVID and an AC era after COVID, right? So I think everybody watching needs to get used to the idea and also tell their friends, tell their family, tell their loved ones that the normal way of life will not be returning anytime soon, okay? Because even when there is a vaccine, it's a case of potentially vaccinating the whole world, okay? That is such a logistical, lots of hearts coming through, thank you, and likes, that's very sweet. Vaccinating the global population is an absolutely mammoth task, right? Before we even get to that point, to get as many people as possible to survive this, which is the end game for me anyway, is educating people, educating the populace so that they know what's going on, so they're not constantly terrified by the media and by the news. So I think I've been going half an hour, just over. I've got to tidy up, as you can tell, it's an absolute mess. So I need to tidy up and get ready. Because on that point, I'll share with you, like, my last bit of my routine of the day is you'll see my mattress is on the wall behind me. So it's, I joke, it's also a padded cell, right, or padded room. But it's actually really important from a sleep hygiene point of view. And the reason it's important is because a few of you might have seen a while ago, there was that US Army captain or major or so. He goes, you want to be successful, make your bed. That brilliant video, right? Now, I don't quite make my bed, I prop it up against the wall. But that's really important, right? Because mixing the area that you sleep and the area that you work is never a good recipe, really. I can remember in Leicester when a student, I had the same room where I had a desk and I slept, right? That can really affect your sleep hygiene. So there's twofold why I've done this to my office right at the moment. The bed goes up to give me a little bit of space. So in between calls, in between meetings, various other stuff that I've got to do, I can stand up, I can do some weights, I can do some sit-ups, I can do some press-ups. Haven't done any sit-ups yet, but whatever, right? But then part of the routine is as I'm getting tired, and as you will see, I'm kind of not slurring my words. It's not as if I'm having a stroke or anything, but I can feel I'm not as articulate as I normally am, right? And that means that I'm getting tired. The bright light, actually, the thing that I've lit for this, it is actually quite bright. So from my well-being point of view, it's probably good to sacrifice production value and turn that light off. Because now I'm not getting that stimulus that's trying to get me ready to wake up, right? So I've turned that light off. And then when I stop or love the make your bed thing, I agree, it's good, isn't it, Tony? And sorry for saying that you just recently had a child and not really knowing who you are. I got confused. But anyway, so then tonight, right, so I'm going to tidy up. I'm going to prepare and plan for tomorrow. I'm going to get my cycling kit ready. And then tomorrow morning at 5 or 5:30 or 5:15 or whatever time I wake up, I will be out on my bike for I am flagging for my 1 day exercise, right? Once daily exercise. And then I will combine that. I'll go to probably whatever M&S or whatever shop I need to go to get the supplies in. And then I'm back in and I'm safe and I'm at home and I feel quite good, right? For 2 reasons. One, I don't have to play Russian roulette with lots of morons outside that don't seem to want to take it seriously. And 2, I've got a massive boost of endorphins to set me off for the day. So then by standing up, by doing the occasional weight, by doing the occasional whatever, I cannot, instead of reaching for caffeine, I can get through the day. And then at this kind of time, I start flagging and I start getting tired. So then I stop using screens. I turn off the lights as we've just done, so it's not as nicely lit video. I'll turn off the light after this video. I'll put some candles on and I'll just start unwinding mentally. So I'll be preparing myself for the first time ever. I've never done this. So when I go to bed at like, I don't know, 9:30, 10, right? I'm preparing myself so that when I go to bed, that's it, knockout. And honestly, I've never had this before in my life. I knock out and then I wake up refreshed 7 hours later on average, 7 or 8 hours later, but I wake up without an alarm clock. I told you there was only 2 days that I had an alarm clock. I can't remember one of them. One was an interview and one was something else. But 2 days when I had an alarm clock. And I hated alarm clocks in the past, right? So what I've managed to do is I have hacked myself successfully, biohacked, as we were talking about in the early things, to modify my circadian rhythm. And your circadian rhythm is kind of that natural sleep-wake cycle for hormones and your body, in terms of that gets you up at dawn and puts you to bed at dusk. Because from an evolutionary point of view, that was really useful to help us survive, right? Because if we're not running around in the dark, what it means is we're not going to get eaten by a saber-toothed tiger, right? So yeah, I'm pleased to report back that biohacking has been successful. This weekend, we're going to try and tot up the number of kilometers that I've cycled. But bearing in mind, I've done between 20 and 80 a day. I've only done 77 once, right, actually. But 20 and 80 a day for the period that I've been biohacking myself, which is coming to about 45 days, right? I agree, Sue, completely. So considering I've done that much cycling and I'm recovering my body, right? So as soon as I do the exercise, I get the endorphin boost. Then for the rest of the day, I'm kind of working. So it's kind of intellectually tiring, but I'm recovering my body. I've got ice packs. I'm stretching. I'm moving that lactic acid out of my body. So yeah, I mean, it's nice. I mean, the only thing that I've got to worry about now is my hair, in the sense that I think it is thinning. But you know what? I'd rather lose some hair than lose my life. And I would rather help get as many people through this as possible with this content and educate you guys about some of the stuff that's going on. Not all of it, there's too much, but some of the key bits. And then it's over to you guys so that you can please share it with other people, right? So I can't remember the person's name. They messaged me very kindly to remind me to put it on YouTube. I forgot to put the pulse oximeter surgery on YouTube, and somebody said, oh, when's this going to be on YouTube? I really need it. So I put it on YouTube because I forgot, we didn't sort it out, whatever. So thank you for that. Thank you very much for watching. People are talking about getting shattered. As you can tell, I'm getting shattered as well. I'm even going to yawn. Sorry, it's so rude from a broadcasting point of view. It's terrible. But yeah, thank you very much for watching. Please share it. I will get round to putting the GoFundMe link there as well. We don't need it at the moment, but we're raising some money for some Facebook ads for when the organic reach does tail off. So thank you very much for watching. Look after yourselves and each other, and I will see you very, very soon. No doubt we'll probably try and do a paper review at the weekend where I'll talk through some of the week's stories that have been quite good. So yeah, keep on talking to each other in the comments, get to know each other, make friends requests, reach out to people that you might never ever talk to. Forget about the stranger danger thing. It doesn't exist. And I look forward to seeing you guys really, really soon. So thanks for watching. And I will try my best to keep up with the good work. Cheers, Lisa.